I'm Rajiv. I go by my first name. The Civic engine is not much. I just started it. It's just me right now. So we'll see where it goes or what I end up doing. So I'll start by maybe just saying just a bit about me and sort of where I came from. I'm an Indian, and my parents are both were physicians, and they migrated to the U.S. in 1970. They migrated first from India, then to England, and we ended up in Oklahoma City in 1970. And I remember being the only, whatever I was, in the northwest quadrant of Oklahoma City for many, many years. And it was an interesting time, particularly as Iran took over the embassy, I took over the embassy, right? So it was a very interesting time, and I grew up both with racism and privilege. And I think that's kind of one of the things that kind of made me who I am. The other thing I did was I grew up in a hospital, and I grew up in like the lower floors of the hospital in the angiography lab, in the cath lab, where my dad was one of the sort of first practitioners of angiography in Oklahoma. At that time there were very few rules, right? So you could apprentice your son in angiography when he was 12. It was interesting. So I grew up with kind of medicine in my blood, and hospitals in my blood, and a great clinician, sort of a caring clinician in my blood, in a medical system that was kind of Wild West and no regs at the time. So I went to medical school, and I practiced medicine in San Francisco in an urban health clinic, taking care of some very, very challenging clients, people with HIV, mental illness, homeless, but also people who were sick and working and struggling, right? Not just, and we did some sort of, some very innovative things, but when you see kind of day to day the first thing that people are asking for is a prescription for housing, right? Or talking about their struggles with like trying to get a job or trying to keep a job or trying to get a better job. And I think I'm not the only physician that sort of sees it, or the only person that sees how that struggle sort of bears itself on the body, and said, okay, so I need to do something about that, right? How do I start an employment program in this clinic? And I went and I got some formal training in public health, thinking that something in public health would teach me how to manage and do something about this problem. Well, I didn't really learn anything in public health that helped me. And I don't think that, but a public health degree, with a public health degree, I was asked a few years later to direct the environmental health program of the San Francisco Department of Public Health. And I was asked to do that because I had done some work in Bhopal, India, responding to the aftermath of the gas disaster. And San Francisco had communities that were demanding action on environmental justice. And they said, okay, this guy, he looks like he's somebody with medical training, but also sort of the sensitivity to work with communities who are struggling with environmental justice. And so that led me, I think that led me on sort of a journey in the San Francisco Health Department for a period of 17 years, which ended at the beginning of 2014, where I did a lot of what I did and what I'm going to talk about today. But I think I'll sort of stop there, kind of with the sort of the bio, and go into it. But I mean, in a nutshell, I think what we were able to do, is that we were able to sort of, by listening to the needs of community members, not the dogma of public health or healthcare, but really listening and responding to the needs of community members using our power and authority. We were able to mix things up. We were able to force accountability of a variety of public agencies to core human needs. We were able to develop a constituency for a new kind of public health, a political constituency. And that lasted for as kind of long as it lasted. And then things end. So I want to start by just sharing a couple of things that I believe in. And I don't know if I've always believed in them, but I think I've always believed in them, and maybe not always articulated them quite so clearly. But health isn't the object of living. And as a physician, I think this is really, really important to be mindful of. Health is one of many capacities that allows us to live the lives we choose. And this isn't, and I think Amartya Sen has described, and been a proponent of this kind of idea the most clearly. And health requires not doctors so much, but the satisfaction of fundamental human needs. And a little bit about kind of a very high level why. This is just so you know where I'm coming from with all of this. Whoa. Okay. That's not going to work. Pause, and let's just try. Is that better? Okay. Yeah, always just unplug, restart. It tends to work. And so why? Why? I mean, my guess is that you guys know this better than I. So this isn't part of my training in medical school or public health, where I think I would say that disease is the center of everything. Sickness is the center of everything. If something doesn't affect disease, it doesn't exist. It's not a factor, right? That's a cognitive bias that's really at the root of what's wrong with public health and healthcare and in our society. But basic human needs affect our health and function. We can't buy a low-carb, low-sugar diet, fruits and vegetables. Our diabetes is going to be out of control. It's direct, right? But probably equally or more importantly, fundamental human needs affect our capacity to protect and promote our own health. When you're telling somebody to exercise and there is no safe place to even go outside, you don't have that capacity. And you know this, so I'm not going to, I could go on with more and more examples, but this is really, really, I think, important, but this is such a marginal idea in health. When you go into the doctor, one of your vital signs isn't they don't even ask your function. How well are you functioning? Are you able to do the things you need to do? Right? That should be like the core vital sign. Right? But it isn't. So here's an idea. I was fortunate to be able to observe the work of a wonderful man named Manfred Max Neef. And I'm hoping somebody knows who Manfred Max Neef is in this room. Anyone? No. So Manfred Max Neef is a Chilean economist. And he wrote a book called Barefoot Economics. There's barefoot health and barefoot medicine, there's barefoot economics. And he authored a theory of human needs. And it's not, it's a kind of a variant of Maslow. But it's a very elaborate, it's a little bit more elaborate, and about needs and satisfiers and different types of satisfiers. And more than that, he put it into practice. He used this theory to do development work in Latin America, with marginalized communities and use the theory to help them figure out how to solve their problems. But our fundamental needs don't change. Does anyone disagree with that? No. And what are they? Jim said I can involve you guys. What's a fundamental need? Okay, everybody, come on. We can just... Yeah. Okay, we got it. What changes is the way we satisfy our needs, right? In time, culture, place, politics, technology, right? And sometimes the way we shift and the way we satisfy our needs kind of screw us up and make us unhealthy, right? Conflicts between the ways different people solve their needs makes one group unhealthy, right? Another group may be healthier, and that's injustice. So, again, not needing to... So despite incredible wealth, needs insecurity is growing in the United States. It's always been there, but it's growing. Wages are flat. Income inequality is increasing. 49 million have food insecurity. 23% of children in poverty. A quarter of people are paying over 50% of their wages in rents, right? That's an incredible amount of insecurity, of stress in our society. That there is no way that the population can be healthy. And what our incredibly rich healthcare system is doing, and what we are all paying for, is that sick care system to manage suffering coming from our social failures. Right? And again, you're the converted here. I don't probably have to convince you all of this, but I think this is the fundamental, problem that I have been working on. Ensuring a basic level of need satisfaction has been and will be the fundamental challenge for population health. And so when I go to conferences with other population health people, I have to hold my breath, because every other person is working on healthy eating or active living. Has anyone, I can't be more kind of sick of that idea. You're going to raise your hand? Do you have a question?
You said that you didn't learn anything that is related to this public health, but as a public health student, this is screaming public health at me.
This is everything we talk about in public health at Rutgers.
I mean, I especially research study I've been working on now on childhood obesity focuses on environmental impacts of what makes people do the behaviors they have. Do they actually have a grocery store and go shopping? Do they have the choice to
Okay.
public health? So
I'm glad you're learning. I'm glad. Maybe it's changed. Yeah. Well, we'll get. How about we continue this? And yeah, I think. How about we continue this? I think that there's a difference between being able to describe the world and change it. Right. And I guess when I say I didn't really learn anything, I kind of already had figured out what the world looked like when I went to public health school for me, but I really didn't learn anything more than how to describe it in a more elaborate way. I mean, and we can get. I'm not. I'm glad you raised your hand. I'm glad you're because I appreciate a good argument. I really do, and I think that public health has not been effective. And I think that their lack of effectiveness is resulting in a lack of support that they complain about. We don't have any support, and they have to figure out. I mean, I'm all for public health. I think as an aspiration, as an idea, as a goal, it's amazing. But as a field, they have not been effective recently. And if they're not effective, they're going to go the way of dinosaurs. And I say that to you as a child. If you're a believer in public health, it's going to take a lot of work. It's going to take, cortisone and adrenaline and a lot of things to sort of get that field up and moving. And there are good people and good ideas, but there are other deep, sort of problems. And what's happening in the healthcare system is also a fundamental kind of challenge or threat to it. But I'd love to talk to you more about this, and